guys. Happy Monday. Or at least hopefully you're awake Monday. Hi, Yatsen. We're just waiting for the rest of our humans. We only have 5 people here, 6. Monday's a rough day to get rolling. And we have time change. So weird. Did you guys know this is the last year I think they're going to do that? I think Oregon and Washington and California legislature said they're not going to change time anymore, which is like, fine. It's just weird.
Wow.
I know it. We don't, it came from when we were more agricultural in order to give us more working daylight hours. And that doesn't really fit. We have a lot of agricultural economy on the West Coast, but not like we used to. Like when I was a kid, my parents were teachers. I grew up in the Rogue Valley in Oregon, and all of my friends' parents were farmers and ranchers, everyone. We were the only people that weren't. So that's really changed too. Good morning, Luz. Welcome. Hi, Usali. I'm just waiting because I've got announcements and I want to make sure I get everybody. So I'm going to wait about 3 minutes. Well, maybe people are going to be late. Oh, that 504 Gateway is you're right, Kenneth. That is a district problem. And I have no idea out at IT what the at information tech at the district office, there's like 45 engineers and technologists that run the district internet. And so I have no idea what a gateway timeout is, but it usually means that they're having a struggle getting people on. And so maybe that's the problem. And that's the reason we only have like 8 people in class right now.
Okay.
I think we'll just wait just a second and then we'll probably get them one at a time. And we also this week, and I'm just so grateful, I should knock on something, that my computer is still working, because 3 of the 7 health careers teachers' computers have died in the last 2 weeks. And so there you are, you've like, for me, I have tons of stuff saved right on my desktop, and I've got videos and like all past assignments and PowerPoints and all kinds of stuff. Those were all lost. So poor Dr. Romanek was just beside himself last week, and he finally got his fixed and got his stuff back. But yeah, it's really challenging trying to keep it going. Plus, we've never had, 9,000 students on Chromebooks at one time before either. And so that's just a little, deal. Anyway, welcome to everybody. I think we have, I don't know, 8 or 9 people now. We're going to go for it. First of all, just a couple of announcements. Welcome, it's Monday. I hope you all had a good weekend. I looked over a lot of our grades, and there's Jeffette. Hi, Jeffette, too. And here's a couple of things I just want to point out to you, and just little housekeeping things. One, if you take a test, like I've made your quizzes available. So for those of you that are getting, that do not have a passing grade, or you almost have a passing grade. I have never in my life seen so many emails from district people and counselors. You're going to continue to get phone calls until your grade is passing. So it's not just me sending a note home to Synergy saying, hey, could you turn some things in? Please take this seriously and know that the phone calls are just going to, not from me necessarily. I will usually, if you're not passing my class, I will reach out to you once a week and say, hey, can I be helpful to you? Or, let's fix it. And please know that I know this is a stressful time, and we'll figure out a way for you to get your stuff done, but you have to come see me in office hours. So my point being that if you take a test that I've made available, I get no notification from Canvas that you have done that. So will you send me an email and just say, hey, Miss Ellis, I took thus and such, or I handed this in? I get no notice. I would have to go back through all the assignments and scroll through every student to see if it's there or not, which I can do. It's just, you're going to get your grade a lot faster if you give me a notice that you've turned something in. So why am I talking about that so much is because I'm posting progress reports on Friday, right? We are already halfway through the quarter, which is like shocking. We're already halfway through the quarter. And I seriously want to give everybody, and I'm trying to give people all the points I possibly can. Kenneth, I don't know that. That's a great question. Should I do that? I think it's a really nice courtesy because I only have 15 students and I support the training courses that we have in advanced health careers. So nurse assisting and training our EKG techs. I do that. But some of your other teachers, like the lit comp teachers, they have 200 students. And they're going to be less likely to see that. I think it's a really nice courtesy if you just say, hey, remember that late assignment that was due a month ago? I finally turned it in. It's just so helpful to us. Okay, so progress reports come out on Friday. And what is this week? This is a very brief unit on skin. I want to make sure also that you know that this is the last reminder today to let district know if you're coming back. I would love to know how many of you are coming back hybrid. If you just put that in the chat, it helps me know, because I have some labs I'm setting up, and it helps me know how, so Kenneth's not coming back. Wait, I'm taking notes. I mean, you're going to stay CDL. If you're going to stay CDL, put that in the chat. This is how I tell whether people are actually listening to me or not, or if they just turned on their computer, because then they don't respond to me. So far, only Kenneth is breathing, as far as I know. No? Here. Oh, Uriel. Oh, sorry. Yeah, of course. Here's Dr. Romanek too. Good.
Good morning, Dr. Romanek.
Hey, everyone. Hi, Dr. Rom.
Hi,
How are you?
I'm good. Thank you.
Good.
Thank you for being patient and allowing me to transition from office hours over here. I get over here.
I know. Yeah. How are you?
I'm good. My house is a little cool this morning, but
What?
yeah, I kind of turn the heat off at night, and so
Oh, well, that'll do it.
yeah, it takes a little while to warm up. So
I was just asking students to, hey, Lupe, yeah, I know Canvas has been kicking people out this morning, and hi, Cindy. What we're putting in the chat right now is if you are going to stay CDL, Could you please put that in the chat so I know how many kids are coming to class?
Oh, very good. Very
I
good.
just want to know.
Yeah, yeah.
So Yatson's coming to class. That's cool. And I'm just writing this on my attendance so I know. Parse is coming to class. Oh, they're going to get a lot of attention from me, 2 students. So,
Oh. Well, the rest are going to stay CDL?
no, I know. No, I'm just teasing because they're
Oh.
not responding.
Yeah.
But, we'll see.
Yeah.
Oh, Luz is going to do hybrid. Awesome. So hi, Luz. That's good.
Yeah, this is good. I think I'll ask my class.
Yeah, I just want to know, poor
Yeah.
Uriel cannot get in here. Lupe's coming back to school, yay. And those of you that are going to be hybrid, that's totally fine. It just helps me to plan and Dr. Ram to plan because we're going to have things to do in class. So you're not coming, Cindy, you're not coming back to class? You're going to do CDL? So guys, just write CDL or hybrid, and that way I know. If you say no, I don't know what you're saying no to.
Yeah. Yeah.
This is classic communication problems. Oh, Cindy is coming hybrid. Oh, awesome. Okay. Oh, Uriel, are you coming back hybrid?
I did. Wow. Wow. So you're going to have a classroom full.
At
By
least
the
I'm-
way,
yeah,
what room are you going to use? Are you going to use 123?
I thought I was.
Yeah, that's what I'm guessing.
That's my nest. That's my home.
Yeah.
Okay. I don't see Eugene here. Anybody else want to let us know? Emily, what are you doing? I don't even know if Emily has her thing on. So, okay. So today, here's what's happening in
So-
class. Yes.
I just thought I would mention real quick. We've been having a lot of trouble with Canvas and Zoom
Yes.
and even the whole network. And you know what? There have been some big storms, solar storms.
Oh, I didn't know this.
Yeah, they're kicking out. I saw this the other night. They're kicking out, I don't know. When it comes to this kind of science, I don't know much, but apparently kicking out a lot of whatever makes it difficult for these systems to work. So last week, was really difficult working online. Everything was so slow. And this morning, just to get a word thing to come up took like a minute after I clicked it for it to come up. Anyway, I think we've got some solar storms that are disrupting things.
Probably makes a big difference.
Yeah.
So if you didn't hear me say this, if you could put in the chat, oh, what is a solar storm? If you could put in the chat, CDL or hybrid, what you're doing in April, that helps me and Dr. Ram know how many chairs and how much lab supplies for you all. And Dr. Ram, do you want to tell what a solar storm is?
Well, I'll be honest, I'm not really good at this, but the sun has kind of a weather system on itself, and so sometimes there'll be an area where it's hotter over here and it's cooler over there. And because of all those reactions, it's kind of a big nuclear reaction. The sun is kind of a big nuclear reaction all the time, and it generates obviously radiation, different kinds of radiation, and sometimes those things kick up. And apparently right now there's been a lot of that going on this over the last week.
Yeah, I think weather is a great analogy for it. Like it's a gaseous weather, it's heat weather. And so Dr. Ram, I was telling them about your computer also crashing and also somebody else is crashing in the department. So what a mess. But anyway, we're glad to see you. And
Thank
those of
you.
you that just came in, if you wouldn't mind sometime during the day putting in chat either CDL or hybrid, whichever you're planning for April, so I know how many students will be in class at school and how many will be online. That'll be really helpful. Okay, so what are we doing this week? Well, what you're doing this week is having a real close look at your synergy grades. And if you know you turned something in and I haven't graded it or I haven't seen it, you need to send me an email. It's fine to turn things in. Progress reports are Friday. So what is happening this week? This week is our 1 week skin unit, chapter 2. And I'm going to start that today. We're going to have a PowerPoint. I'm also going to show a short video, the teeniest and tiniest little career piece on a lab technician, because we've been talking about cells, and cells are the work and business of laboratories. So the laboratory at St. Vincent's Hospital, I don't know how many employees they have, more than 100. And that occupies almost half of the downstairs of St. Vincent Hospital. And there are numerous careers represented there. I'm going to show you only one. And here's the reason that I'm showing it to you. When part of being a human, this is Mrs. Ellis now talking teacher to you, part of being a human is knowing what kind of person you are. And I'm going to tell you about a student that I had, 10 years ago, named Matt. And we kept sending him in the hospital. His mother really wanted him to be a physician. He didn't know what he wanted to do. He did not like going to a doctor's office and shadowing a doctor. And then we gave him a rotation, just kind of because he wasn't interested in other things, down in clinical lab. And here's what he said when he got done. And it just made me feel so good because he'd been so frustrated all spring. Here's what he said. Miss Ellis, he said, those are my people. He said, everybody keeps trying to make me into a person that wants to work with hundreds of people and be really interactive all day. And he goes, I don't like that. He goes, what I like is having my own work and being able to be very detail oriented and to concentrate. He said, I love looking in microscopes. And he ended up with a career as a medical lab technologist.
Wow, that's so great.
So, and a lot of it was just, we don't know until we see it. So when I show you these videos, or Dr. Ram does, we are not trying to sell you on the idea of becoming this. No, we are showing these to you with the idea that you'll simply look at it and then think about yourself in that setting and think about whether it's something that interests you, because you are the person who's going to go to work every day at these settings. And in the lab, as I'm sure you'll hear this tech talk about, it's such important work. You are supporting the diagnosis, accurate diagnosis of patients. So we're going to watch this short video. There is no reflection on this week. And then after that, I'm going to follow that with just an introductory PowerPoint on skin, just the very tiny basics. So then tomorrow, I'm going to do some drawing. You're going to do some drawing. In-class assignment on Thursday. You do not have a test this week other than to the chapter 2 medical terms have a special part of the assignment. If you haven't seen that, you need to go capture that from Friday's classes where it's posted. It's called chapter 2 med terms in our assignment list, and it's available to everyone. That is due Friday. And then that's it for our skin unit. There is no homework over spring break. So questions about that? Oh, Davis is coming back hybrid. Oh, Davis, we look forward to actually seeing you as a person. That's going to be exciting. Okay. All right. Dr. Ram, anything?
No, this is great being here. Thank you.
Let's watch this vid. Oh, that's not what I wanted to do. This is. We'll see if it can handle a video this morning. Some days it can't.
Hi guys, I'm Faiza. I work at Wellington STL as a microbiology and molecular technician. Laboratory technicians do different testing to find out what is causing a disease or an infection. We are basically like science detectives who are trying to help the doctors to diagnose and choose the correct treatment for the patient. It makes me feel like I'm doing something good in this world. So microbiology is the study of microorganisms, which could be things like bacteria or fungi. Molecular is just the same thing, but we're looking for the genetic material of those microorganisms. The difference is that in microbiology, you have a sample that you can grow, and because you can grow, then you can do antibiotic testing that's suitable for that bacteria. But in molecular, you have a target, which could be a DNA and RNA, and that's what you're finding. When you're a laboratory worker, you do shift work. I do 8 a.m. until 4:30, and sometimes I have to do 1 p.m. until 10 p.m. I would look at what area I'm covering and how much samples I have in the day that I need to be finishing before I go. But you can never predict the workload. It can always change day to day and season to season. In my department, I work with 40 people. We test community and hospital samples. So we do a variety of tests on different samples, and those samples could be blood, urine, feces. We do a lot of different kinds of swabs, which could be throat swab, genital swab, wound swab, and you get a lot of different bacteria and microorganisms from all of these. Today I'm doing fecal PCR. So these are for people who have gastrointestinal problems. They could have salmonella, they could have Campylobacter. So that's what we're trying to find out by doing this testing. I like how I have a variety of work because there's so many areas that I can cover. Week to week, we always get different microorganisms, which makes it more interesting. I like how in microbiology, things are colorful and every bacteria grows in different conditions. I like how sometimes it can challenge you to think in a different way. I'm looking at some fecal results now. Someone analyzed it earlier and I'm just doing a second check on it now before we finalize the result. This patient is positive for Giardia. This patient is positive for Campylobacter. This patient is positive for Shigella, and I'm happy with all of them. Perfect. That is all done. This role would suit for someone who is passionate and interested in human health, and they like thinking in a scientific way, and they are up for a challenge. It's also important to know it involves shift work. It's physical. You could be on your feet all day, and it involves a lot of sample handling. This looks like it's so many samples, but this is actually for only 7 samples, and we're on sample 27, and normally we do more than 100, so it's gonna be lots of plates. To get in this job, you need a science-related bachelor, and after that you have to sit for an exam, which is a medical laboratory exam by Medical Council. From there, you need to work full-time for 1 year to become a registered medical laboratory technician. From being a lab technician, you can also get into research or going into different labs to expand your experience. We even have people here who are team leaders and managers, but they used to be lab technicians. Thanks, Sarah. I'll see you soon. Keep in mind, in some labs, you can work full-time and study part-time to become a scientist. I'm passionate about helping people, and that's what I'm doing here. For me, that's the part I enjoy the most, that I'm helping people.
Okay, so she's Canadian and our system is a little bit different in terms of our lab technologists. But the reason I really like that video is it shows a lot of just physically what she's doing every day. Number one, she's wearing protective gear and she's changing her protective gear between patients' samples. So when someone's blood comes to the lab, especially since she works in microbiology where things can be infectious, like COVID, she's changing her clothes a lot. She works with the same people every day. So that is also something to think about. If you like working on a tight team, there are certain careers that really lend themselves to that. Any questions about her in the chat? She works, guys, in a department with no windows, with a lot of technology, a lot of computers, a lot of accuracy required. She mentioned she was the double check on some of her labs, meaning that someone else already did the test and then she did the test again. Why? Because we don't ever diagnose a patient with one piece of evidence, ever. This helps with accuracy. So if you are thinking of a career in science, but you're thinking, I don't want to go to med school for a long, long time, and I definitely am more reserved and I'd like to work by myself, this is a really good option. Okay, Dr. Ram, you have anything you want to say about that?
No, I thought that was great. I think it was fun to get to hear say some words as the more in a as the English would say them than we laboratory and
Laboratory.
yeah, that was kind of fun.
Yeah. Okay. So the next thing on our list is to look at our PowerPoint, and yes, you need to take notes. So I've changed my assignment for this class, Dr. Romanek, because of you.
Oh, really?
I have, because I think you're right. For this class, they need to be taking notes.
Oh, yeah, yeah.
Okay, let's get this over here. Now, can you see this?
Yes.
Yeah.
What does this mean? I don't know if you guys have noticed, but whenever we have a new unit, Mrs. Ellis likes to start out with diseases. Why? It captures my brain better. And I think it would for me as a student too. Something that doesn't look quite right to me helps me to be really interested in the anatomy. And so what does pathology mean? We talked about that before. So ology means what? Where's my chat line? Here we go. Study of diseases, thanks. Oh, I love your other question too, which I will answer. Yeah, Eugene, actually, ologist is a physician who is a specialist in the study of diseases. Ology just means the study of, so that means just the academic amount of information, the body of knowledge. A pathologist is a medical doctor that's done a 5-year residency in diseases, and we need them. And pathologists can have specialists. We have a lot of
amazing. They are absolutely amazing.
Just in terms of what they know about tissues and cells. Wow. Oh my gosh, it's just amazing to be with them. So I'm going to answer also Kenneth's chat about how do they have ventilation in the lab from virus spread? Such a great question. Because I think if you're thinking about working them, oh yeah, yeah. How do they? They have all specially designed. And if you're a person that's interested in medicine, but you want to be an engineer, they have an airflow system and different kinds of negative pressure hoods that hang over the specimen tables and essentially move air up and capture it and move it away. So it isn't like a regular room. It has what's called a negative pressure environment. And it means that air is being moved away from the people who work there. Yes, some are dangerous, Kenneth. And many are not, especially, as I'm going to quote Dr. Romanek, especially if you have a functioning immune system, you're going to be very unlikely to get things. Yes, and so the medical term, Eugene, you're making me giggle. The medical term for poop is feces. And the only time we say poop in the hospital is if we're talking to a child or to someone that we think wouldn't understand that. So yes, because what is in your feces tells a lot about you, and you can have bacteria growing there that are making you very, very ill. Okay, that's a part of pathology, is what is growing in the patient's GI tract. Dr. Ram, am I correct that we have as many bacteria? Yes, Kenneth, that's right. Do we have as many bacteria growing in us as we do cells?
The truth is we actually have more than we have cells, and it's actually much more.
Wow.
It's amazing, isn't it? It's
Yes.
absolutely amazing.
So just think about that, guys. When you look at yourself today, know that you're mostly bacteria.
Yeah.
Makes
Yeah.
me want to wash my hands, but I know I need my bacteria. Right? We didn't really used to know about that. So yeah, some of you missed this on our test because we use the term cardiologist. This is a physician specialist. Cardiology is the study of hearts. So always working. So 5 common skin pathologies. These can be little things. These can be little things that turn into big things. But what we really have to know to even think about it is, what are the skin layers? And last Friday, I assigned you the reading, I think through page 22. There's a couple of good drawings there for those of you that did the reading, that pre-read. It makes class easier.
Mhm.
So Dr. Ram and I are also always teaching college and school strategies. And so here it is. When a professor or an instructor assigns reading, they're not doing it because they need to find some busy work for you. They're doing it because in the next couple of days, they're planning to talk about that subject. And they're planning to probably move a little faster than you want to go. And if you've pre-read the material, you're not going to be lost. So often students are really nervous about school. And who can blame them? I was nervous in school too. But this is one of the things that solves that anxiety, is preparation. And no one can do it for you. It's something you have to do for yourself. True, Dr. Ram?
Absolutely.
Yes, thank you, Eugene. Absolutely, you did the reading. And Kenneth's giving a great another vocabulary. I'm going to move this chat so I can see it better. Okay. So here we go. What are the 3 layers of skin? Epidermis, top layer. Epi means up on, and then 2 molecules that are important that I'm going to talk about tomorrow: keratin and melanin. Melanin we've already talked about a little bit because we had a patient that had a melanoma. And I'm going to try to not go as fast so I can give you time to take notes. The middle layer is called the dermis. That's kind of what's holding you together in your skin. So that has the molecules collagen, elastin, sounds like elastic for a good reason, and then reticular fibers. These are all what I call substance fibers. They're what give you form and shape. Yes, Eugene, absolutely. We were talking about, so Eugene, I'm going to share that because it's so good. That knowing more about the skin helps us to understand how burns work. So Uriel was talking to us last week about he got burned. He burned his leg on a motorcycle, Dr. Ram.
Yeah,
Really common.
there he is.
Burning the medial aspect of your leg, your lower leg on a motorcycle is so common into the emergency room. And I was telling them, Dr. Ram, that what worries us in the emergency room is when a patient doesn't pull their hand away in a reflex motion.
Oh,
So they get a 3rd-degree burn when they really should, right, Eugene, they should have had a 2nd-degree burn. Then these are things that we wouldn't say out loud to a patient right away, but we might be like, wow, why did they not jerk their leg away? Could they not move their leg? Did they not feel it soon enough? So understanding how these layers are constructed tells us a lot about how deep a burn is and what the patient should be experiencing. So hypodermis, the very hypo meaning lower. So if we just dissect this, hypo meaning lower, derm meaning skin, the lower layer below the skin, where the capillary, little tiny blood vessels are. Yeah, so Emily is asking one of my favorite questions, actually. Is this the place where your skin absorbs sweat? We don't really absorb sweat, but infiltrate beauty products. Oh my gosh. Have you ever read the label at Bath and Body Works? Like when I go in there, I read the labels, and next time I'm in there, if I'm not too embarrassed, I'm just going to shoot a bunch of pictures of the ingredient list. So what we were talking about a little bit, Dr. Ram, last week was that when you put something on your skin, we tend to think we're not porous, like that we're waterproof, and that anything that you put on your skin soaks in.
Yeah.
So if you're putting propylene glycol, which is a really common preservative in beauty products on your skin, it's an oil derivative and it's highly toxic. The beauty companies have to stay under a certain amount of it, but they can put it in their products. And you are putting it in your body, and your liver in particular has to figure out, and your immune system have to figure out, what is that?
Yeah.
That this person either just ate, or what is that chemical? So yes, Emily, being really careful where you buy your beauty products is really important. There are a lot of cultures that really, in terms of like moisturizers, all you women, like, just listen to Miss Ellis. They just use things like olive oil or coconut oil, which is, is a food. So your body is not too challenged. So 3 layers, epi meaning top, skin, dermis meaning middle. Tomorrow we're going to talk more about all these extra vocab, this collagen, elastin. These are the function pieces. So today, just a little bit on form, and then lower level. Dr. Ram, do you want to say something about that?
I do want to say something about our terminology here.
Yes.
And since these students are going to be with me for Anatomy Phys next year, something that I want you to be aware of and regarding the anatomist is the anatomists were very, very, very consistent. And so here's what I want you to know. When they say epi, as Mrs. Ellis mentioned, that means upon or above. And then they have hypo. Well, let me just tell you, they would never call something the epi if they weren't going to have a hypo. In
Oh,
other
okay.
words, we have this layer that is the dermis. That's the middle layer. And then they said they named this epi as the layer upon the dermis. And then this layer, the hypo, as the layer below the dermis. And they were very consistent in naming things. They would never have an epi if they weren't going to have a hypo.
Okay.
So that's just to help you understand that as we learn things in anatomy, physiology, that consistency is always there. So if you ever, as we learn, if we ever have something that's called the epi, we're going to know that there's a hypo. And it's not just epi and hypo. There's lots of things here in anatomy where that consistency always plays in. So I just want you to know, it's amazing how consistent and how organized the anatomists were in naming structures.
So Dr. Ram, and then I'm going to answer Emily's question. Emily's question, I have a question for you, is like, when you're talking the anatomist,
Yes.
IST is an expert in anatomy, an expert in parts. Who are you talking about in terms of history? I just want them to know. So when you say the anatomist that put this together, the Latin word roots, what years are we talking there?
Oh man, wow. We could go all the way back to the Egyptians.
Right.
Yeah, they're the ones that we know studied anatomy early. And you know what? We don't think about the Chinese too much, but I bet if we studied the Chinese, that we would find out that they also way back started studying the human body.
Anatomy is an ancient art and science, and it is not finished. So because one of the things that I really love about medicine is that we don't know a lot of things. We don't know, for instance, when I worked at the trauma hospital, we would have 2 patients with similar injuries, very dramatic injuries, like they fell off a building or they got hit by a train or something big happened. And one of them, who had life-threatening injuries, and everyone, including the physicians, were saying the patient won't survive. The patient survived and completely recovered. And then another patient did not. And so there's so much mystery along with our science in medicine of why certain people survive and don't. There's a lot to learn. Now, Emily has an excellent question, which is this why we call an EpiPen an EpiPen? Is it upon something? EpiPens are named after the drug epinephrine, which is a life-saving vasoconstrictor. So it helps to prevent a life-threatening inflammation when you're allergic to something. So what I want to say I love about this is that in epinephrine, does it still mean upper, Dr. Ram?
That's a good question. I would have to look that up. I would have to look that up because, and here's the reason why. Epinephrine is a hormone.
Right.
It's made by the adrenal gland. Yep. And to the common person, every one of you in the class knows what epinephrine is, because to the commoner, epinephrine is adrenaline. Yes. So, but again, and adrenaline is a medical term. It's just that we tend to use as a medication. We don't call it adrenaline at all. No. In physiology, both terms, epinephrine or adrenaline, are correct. But I think if you were talking to a physiologist, I think most of the time they would use the term epinephrine, just because the common person who has not studied anatomy or physiology is probably going, they're not going to call it epinephrine. They're going to call it adrenaline. So I think among the ologist, the anatomist, the physiologist, the pathologist, they're always going to use the term epinephrine. And I will have to see if I can find why, or if epi in epinephrine means above or upon. Now, here's the thing. I will tell you this, and I do teach this to my students. The adrenal gland sits on the top or the superior pole of the kidney. And so it may have something to do with that, the adrenal gland is sitting upon the kidney. So it might have something to do with that, the epinephrine, the epi, upon.
Okay, so the excellent question, Emily. Please know that right now that's a medication, life-saving med. Glad we have them. So now that we have these 3 layers, we're simply going to look at some pathologies associated with the layers of skin. So here we go. I love this picture. Is it cool?
Yeah.
Blisters are fluid-filled sacs between the dermis and epidermis. I think a lot of people in this classroom have had a blister. It can be caused by friction, meaning my husband just got a blister on his heel from a new pair of tennis shoes. Rubbing, or a burn. So we damage and inflame those tissues, or an infection. The layers separate and form this bubble. Should you pop the bubble, Dr. Ram?
Well,
Notice how I make Dr. Ram answer all the treatment questions.
yeah. So if I had a patient, for example, if your husband came to my office and I was treating him, I would remove the fluid from the blister.
Okay.
And then I would put, a medication over it, and we would bandage it in such a way, and we might even use a donut type bandage to prevent the further friction there, because as you say, that friction, what it did is it caused the 2 layers to separate, the epidermis from the dermis, and then the interstitial fluid filled the sac. So if I was treating it, yes. At home, it really kind of depends. Often we tell patients not to pop them at home.
Yeah. Infection wise, I think if it's in a place that they can protect, but often you're going to see a picture often of what happens.
Yeah, there you go. Oof.
So there's the top of it has been pulled off by friction. And now this is all exposed to the things that we were worried about in that clinical lab video. So our skin is a protector, remember? Integument, a covering, the integumentary system, a covering, a protectant. And so when it's exposed, the patient is vulnerable to infection. Now, most of you have these really high-speed immune systems that can take care of exposures, and you're not going to get an infection there. But if our patient is 85 years old and diabetic,
dangerous.
Then it's a very dangerous thing to have happen. So because her immune system is slower, they have more sugars for the bugs to eat. So we're going to be teaching you about these things all during health careers.
So Mrs. Ellis, may I just add real quick, because you made an excellent point here. In that 85-year-old patient who is diabetic, this is dangerous. And there is a profession, podiatrist, and you might not know a lot about podiatrists, but podiatrists are doctors who care for people's feet. And much of their practice is taking care of diabetics and making sure that their feet are healthy. Now, that sounds like a little thing, but in this scenario where we're talking about an 85-year-old patient with diabetes, that is sores, untreated sores on the feet become life-threatening. So that is very, very important.
And so Eugene, exactly, I'm guessing you know some more about this than some of our students, that yes, they can get necrosis or dead tissue on their feet. And the other really interesting thing is, they may not feel this. If they get a big
Exactly.
infection, a lot of patients that have that diabetic condition over time, their nerves dysfunction, and they don't know that. It's not like you and I, if we got a sliver in our foot, we would be all over looking at it and thinking like, I need to get that out of there. A patient that has diabetes and has real serious conditions in their legs, like Dr. Ram is talking about, they might not even know it until they got a fever from it. So really interesting. I'm always telling students, Dr. Ram, that thinking is the cure for boredom.
Yes.
And so if you're a person that doesn't want to be bored, then learn how to think. And you'll be fascinated your whole life, and you'll be learning your whole life. So this is just us parenting you now. Calluses. So a little pixely, this picture, but calluses are caused when a particular area of the skin is rubbed against a hard object, like a shoe or another toe, and the epidermis reproduces itself and makes itself hard. And so in this picture, I think right here is really where the hard kind of cracked epidermis is. And right here,
Absolutely.
a lot of students get calluses on their hands, like on their supporting finger for where they hold their pen. So they would get it right there. You get little calluses also.
Yeah.
And calluses can be a problem if they get enough friction on them, they can pull off and expose the dermis and even the hypodermis. Yes. Do you have calluses from video games? No way, Eugene. Oh my gosh. Okay. I know you're not joking. I'm just teasing you. Yeah. So, but you can get calluses from, skiing, bike riding, tennis, playing softball, golf, anything that where you're holding something, gripping something, or ill-fitting shoes.
Yeah.
Are not helpful.
So Mrs. Ellis, can I just comment on this?
Yeah.
If you'll take your cursor and show them that callus in the middle of the, right there. This is often caused because we have what we call dropped metatarsal heads, because there's an arch across right here. See, there's 3 arches in the foot. There's the one we all know about over here on the medial side. And then there's an arch on the lateral side. And then there's an arch that goes from the metatarsal head of the big toe across the foot to the metatarsal head of the little toe. And so this, when we see this, usually we have dropped metatarsal heads at the second and third toes, the one next to the big toe and the middle toe. And we'll go in and we'll treat those. We'll go in and we'll make a manipulation on the foot to raise that metatarsal head up, and then we'll support it with an arch support that for this anterior arch.
Okay. So if you're getting a lot of calluses, there may be a reason other than friction.
Yeah. Well, the friction, the friction's increased because the mechanics of the foot aren't, the anatomy of the foot has been altered. When the anatomy is altered, the physiology is altered.
There you go. Acne is a form of dermatitis or inflamed skin. So remember our word roots: derm, skin, a combining vowel, and then itis, inflammation. This is called by the irritation of your oil glands, sebaceous glands. Which skin layer has the oil glands? That's in the reading for you to look up. So you don't have to do it now. And so if you haven't figured this out, also about Miss Ellis and Dr. Ram, we don't like filling in every blank for you. Why? It's boring. Yeah. So I would just jot that question down in my notes. And then when class is over, I think it may be page 20 or 21, I can't remember. There's a clear drawing that shows you right where the oil glands are. Oil glands can get plugged, they can be slow. A lot, some of this has to do with what you're eating, some of it has to do with what you're showering with, some of it has to do with your age and how much hormonal activity you have. So our skin, my message here is, our skin is such an indicator of health. And we sort of think, oh yeah, you know, but no big deal, skin problems. Skin problems are an indicator of the patient overall. So this can be one of the first things in the emergency room. And I always have to talk about, of course, what I know. One of the first things I look at if a patient is dropped off by an ambulance is the color of their skin. And it's an indicator of whether I need to look further for problems. So dandruff, white flakes, are dead epidermis that fall off the scalp. We all have some of these, but having a lot, like in this picture, are that you have oil glands that are either too active or inactive. And the epidermis, your epidermis is always shedding to some degree, all over. Your skin is changing, but to have lots of it, there's some issue that needs to be addressed with the patient's scalp. There's just another picture.
Yeah.
And another really serious form, more that has more inflammation on that person's scalp. So if you're a person that's like, oh my gosh, this is so interesting, this is dermatology, folks. So there's dermatologists all over Portland right now. And you think, a lot of people think, oh, dermatology is like, oh, you know, helping people like have their skin really glow. It's treating disease processes that look like this. Okay, that's epidermis flaking off. Oh gosh, I think this one's pretty interesting. Nail fungus. Have any of you ever seen nails that look like this? Be careful, ladies, where you get your nails done. Because you can get nail fungus at a nail salon if you're not careful. So nail fungus is an infection under the keratin part, the epidermis layer of the nail. A fungal infection that is called a mycosis. So myco meaning fungus, condition of osis, condition of fungus. And they are, I'm going to underscore this, they are very difficult to treat. Like, do you take medicine for a year, Dr. Romanek?
Oh man. You know, nail fungus is very difficult. And, you know, some of them you control, but you don't get rid of. And so some people will end up taking medication for years. Yeah.
1 second.
Yeah.
Nigel.
So with this, you know, there are over-the-counter medications that people use and they put it on it and it might help, but it's very difficult with a topical medication to actually clear this up. It's usually an oral medication that needs to be taken. And the reason for that is because this fungus is it's actually under the nail and it's here where the nail is growing. And so when we put a topical medication on, we can't really get to where that fungus is. And so people, the over-the-counter topical medications are probably not going to take care of this. So that person needs to go to their doctor and get a oral medication.
So when you ladies, when you're getting a pedicure or getting your nails done and you see them spraying all that stuff all over to try to clean those tubs where your feet go in, this is why. Because the health department in Oregon will shut down a nail salon that has reported cases of fungal. And this can happen at any age. So just be careful. So there's another picture. These infections can take up to a year. They really just sort of make your toes look like something's been eating them. Something has been.
So now the reason it takes so long is for the reason that I mentioned, because we have to clear out the infection at the source here where the nail grows. And so you see, as the nail grows, if there's any fungus there, it's going to continue to grow. And so, you know, the naturopaths and the chiropractors, and I would guess the podiatrists, they would also very frequently ask the patient to change their diet a little bit and really eliminate, minimize the intake of simple carbs, because
Like sugar,
fungus and yeast love sugar.
white sugars, guys. So he's talking like candy.
Yeah.
So, and sometimes when we say simple carbs, kids are like, well, I don't eat that. So just saying, we have to be
Yes.
careful about what we eat too. So just good pictures, so that the other thing that Dr. Ram and I are trying to do is to help build up in your brain a clinical file of things, so that you won't go in front of a patient someday, oh, yuck. But you'll be like, oh, okay. And have in your mind, starting now, a library of things. Oh my gosh, that looks kind of like a fungus. I think we need to send a specimen to the lab tech and identify which fungus is that that's growing there. So you see how medicine is a team. Dr. Ram can't make a diagnosis. He probably could and be accurate, but he needs to have lab work in order to say, oh yeah, look, this is an atypical, an unusual fungus growing here. So just want you to see the connection.
Now, if you don't mind me adding just one more thing here, what the doctor may do, and you know, the family practice doctor probably wouldn't do this, but the podiatrist would have no hesitation in doing it. And what they might do, if the nail on the left on that big toe, that's more severe than the one on the right. But I'm going to tell you something. You see that this person has it in other nails as well. So to really start to get ahead of this, and especially if it was just in one toe, they would have no problem removing the nail. They would just go in, remove the nail, and then they would use a topical along with an oral.
Okay.
And believe me, I've seen that done. And
I don't want to see it done.
yeah,
I mean,
the technique that the doctor used was incredible. I mean, he was so efficient, and he was in and out of there just like that. But yeah, that it isn't to see it isn't fun. I mean, you just think of, wow, that hurts.
okay, and then we've seen this picture before, looking at this and remembering that this is a melanoma. And this was on their test last week, that what is skin cancer when one or more of the skin's layers multiply in a rapid and uncontrolled way. It can be caused by sunburns because it damages the cells. And I've just put a clue, this is from your reading exactly, which says, look for a change. Look for big changes. Look for an irregular border.
Yeah.
So this is the border.
Yeah.
It's not nice and round, like, so some of you have sent me pictures of moles, which I just love. Oh, Miss Ellis, what about this mole? And I have sent back, what are we worried about? Is it irregular? Is it changing rapidly? Is it multicolored like this, or is it mostly just one color? Is one side the same as the other? Is it symmetrical? And this one definitely is not. So, is this side the same as this side? Okay, so helping you to understand the role of anatomy. How would we diagnose this patient? We still need our lab people. We need a piece of this melanoma to go to the lab and be looked at by both a tech and then by a pathologist to make a diagnosis. Okay, and then there's a lot more we can say about melanomas. So, questions about that, or Dr. Ram? Okay. You have an assignment to work on, which is chapter 2. Please read the assignment carefully. It has a little twist off our usual vocab. That is not due till Friday. Your job is to do your reading And to remember the skin layers. So questions before I let you go. Oh, the other assignment is this. Look at your synergy. A couple of you are way behind, and I'm already talking to one of you. The other person needs to contact me. A couple of you just need to turn in a couple of assignments. We had a student last week that had a not passing grade. She turned in one assignment. She has a B now. Guys, a 0 in the grade book is just so bad on your GPA. So if you turn in something that we can grade and help with, that's huge. So look at your synergy today. Progress reports go out on Friday afternoon. Okay. If you need something, put it in the chat or stay. Otherwise, yeah, I'm awesome. Kenneth, I love it that you have your assignments done. And this is the work of being a student. So,
Bye, everybody.
Bye.
Thank you.
But you can go. Take care of your callus, Eugene. Take a day off. Bye.
Well, have a good day.
You guys
Bye.
have a
See
good
you
day.
tomorrow.
Bye. Bye, Yatsen. Bye, Uriel. Bye, Parsa. Bye, Cindy. Parsa. Bye, Yatsen. Guess we'll put Parsa in there unless you want to come back, Parsa. Okay, let me stop my record.